Assalamualaikum and good day to everyone. Let me begin by introducing myself. My name is Muhammad Alif bin Muhammad Idrus, a student at UPMKB. Today I am going to address how important communication through social media is in educating the public. How did this problem become well known? That is because recently a number of doctors have used social media as a tool for health communication in order to inform the public. I assume that this approach can assist people in obtaining new information in addition to merely browsing social media. There are many reasons to support this cause, such as explanations for the ability to publicly exchange information, the ease with which disease is caused, symptoms and treatment can be learned, and information and knowledge are delivered by skilled and trained doctors. Okay, first of all, the term social media refers to the process by which people engage in interactive communities and networks by creating, sharing, or exchanging knowledge and ideas. Since the data is securely found on the internet and shared through a digital medium, it will ensure the patient's safety by reducing medical and drug errors. To make an example, a diabetes survivor share their knowledge on how they overcome and how to prevent such obstacle in the web. When someone goes through the article, the information will be passed on to the other individual and goes on. It is very often that medical organization will go through any article regarding to medical purposes and approves it to the public to keep away from misleading. Since the social media is comprehensive, we can look up anything on the web. In case if we are having symptoms that we are not able to recognize, simply look it up on the web and we can identify what kind of disease that we experience. Other than searching up for the symptoms, on some occasion we could also find ourselves the appropriate treatment at the moment. Hence, we are able to conserve a significant amount of precious time and money for the unnecessary medical checkup. In this matter, to find the perfect treatment, trusted and reliable source is compulsory in order to avoid major incident. To summarize my point, all the information needed for a disease and treatment could be on the web if we look hard enough. Uh, my final and last point is the certainty that the information provided by trained and qualified doctors. As stated from my first point, all of the articles about medical are often examined by qualified doctors to avoid and evade misinformation. For the reason of that, it is their responsibilities to correct and verify to ensure the readers that it is credible. Furthermore, doctors usually have their own website based on their own specialties. Qualified doctors are usually linked up to their workplace, which could be the government hospital or private facilities. Using the procedure, the doctors will not be anonymous and readers will feel at ease without feeling suspicious when reading an article for medical purposes. Based on my points stated, the use of social media to communicate health information is effective in informing the public. Following recent rapid advances, it has been proposed that research on the internet will have the potential of such online interventions on public health in the coming decade. With the correct method and procedure, we could find the knowledge desired without any consequences. Without any consequences. That's all from me. Thank you.